Is my audience? The room is spinning. Your vision is blurry. You don't understand what's happening, but you can hear a powerful voice booming over the muddled noise of commotion. We don't have enough O-neg. Figure out his blood type. He doesn't have much time. Suddenly, the room stops spinning. You lose your vision, and that sound of commotion slowly fades away. A life lost to a shortage of the national blood supply. Working in the emergency department, we give blood to patients all the time. Yet on June 10th, in a personal communication from B. Hennessy, we received information that the entire hospital has only about a 1-day supply of blood left. The opening scenario is a little unrealistic, but we are currently in a national blood supply shortage that has the potential to become catastrophic. According to the American Red Cross's webpage, titled Blood News and Blood Supply, someone in the United States needs blood every 2 seconds, so it's vital that eligible citizens pay it forward and make an appointment to donate blood today. In this speech, I'm going to establish how the national shortage is a problem, outline that the solution to that problem is donating blood, and explain how you, as an audience, benefit from donating. And then I'm going to make a call to action of setting up an appointment to donate your blood today. Because of COVID-19, we are in a national shortage of blood. Now, this is not from the virus itself, but from a lack of donation, from blood drives being canceled, blood centers being closed, and social distancing in general. According to the American Red Cross press release on March 17th, there have been over 86,000 fewer blood donations since just the beginning of this pandemic. In emergency situations where blood transfusions are necessary, type O negative blood is used first because of its title as a universal donor. Due to this universality, it's in high demand and will be the first to run out in the event of a shortage. The Red Cross's webpage, titled Why is Type O Blood So Important?, cites only 7% of the entire population being O negative, so it's very important that these people step up and know their blood type and donate. This shortage in the blood supply is an enormous problem because it's a matter of life and death. Blood is given in emergency situations such as motor vehicle accidents or bleeding to death after childbirth, but it's also given during surgeries, to cancer patients, and in so many more events. If a patient loses too much blood and can't get a transfusion, they may face death. In order to solve this problem of a national shortage, it's imperative that we take action as a community of young people and donate our blood. Jerome Adams, the current Surgeon General of the United States, in a press conference on March 19th, urged young people, millennials and Gen Z specifically, to answer this call of donating blood and solving this current national shortage. While most people are able to donate, there are certain qualifications you must first meet. In Iowa, according to the Mississippi Valley Regional Blood Center's PDF titled Donor Eligibility, these requirements include being 17 years old or 16 with parental consent, weighing at least 110 pounds, being in good health, and having a photo ID. Now that you know you're eligible to donate, let's take a look at that process. You'll set up your appointment and arrive, and then go through registration, where they will in fact confirm that you are eligible to donate that day. They'll do a health history, where they'll get all of your medication history, and to a quick exam. Then you'll move on to the actual donation, which is the shortest part of the appointment. When you're done donating, you'll get a snack and wait about 10 to 15 minutes just so they can ensure you're good to leave. Now we've established that the solution to the current national blood shortage is for individuals to donate blood. But how do you, as an audience, benefit from this solution? Aside from the knowledge that you're directly helping people in need and potentially saving a life, there are a couple health benefits to donating blood. For those without a primary care physician or those unable to afford an annual checkup, donating blood is a great and free way that you can identify some common health problems, such as high blood pressure or low or high iron levels that can affect your heart. When you donate, Your blood is also tested for infectious diseases, and you'll be notified in 24 to 48 hours if you come back positive for anything. According to the Red Cross's webpage titled Infectious Disease Testing, some of these common tests are hepatitis, HIV, among others. Currently, at least through the end of the summer, they're also testing donor blood for COVID-19 antibodies in order to identify if you've had the novel coronavirus. In addition to these health benefits, some companies provide monetary compensation for donating plasma specifically. BioLife is one of these large companies we have locally that will compensate you about $20 to $50 per donation, but that all depends on how many times a month you donate or if they're running any specials. If you decide to go this route of donating plasma due to the monetary compensation, you should still consider donating your blood because it's extremely important in emergency situations. After establishing the national blood supply shortage, outlining that the solution to that shortage is donating blood, and demonstrating how you as an audience benefit from this solution, I strongly urge you to consider donating your blood and making an appointment today. You can find a blood drive near you by visiting the Red Cross's website, redcrossblood.org, or calling them at 1-800-RED-CROSS. You can also visit the Mississippi Valley Regional Blood Center's website at bloodcenter.org. As the younger generations, let's step up and answer the Surgeon General's call to donate blood, end the national shortage, and most importantly, save lives.